Hello, ladies and gentlemen. Austin Petersen here, former presidential candidate for the Libertarian Party. Welcome to the Freedom Report live stream tonight on YouTube. If you're watching us later on Facebook, just so you know, we do these normally Mondays, Wednesdays, and Thursdays at 8 p.m. Central Time, 9 p.m. Eastern Time. Tonight's a little bit early because I got an event to go to later. So welcome to all of our viewers. Thank you so much for tuning in. If you want to listen to the Freedom Report audio podcast, those are on iTunes and on Stitcher. You can find them by typing in the Freedom Report on iTunes or on Stitcher. This morning we had a discussion about a lot of the attacks that have been going on against Senator Rand Paul for his confirmation vote for Jeff Sessions, his reasoning for doing so, as well as his unwillingness to launch an investigation into a national security advisor for President Trump, Michael Flynn, who was allegedly speaking to a Russian ambassador about loosening embargoes and restrictions on Russia. It's a big scandal that's blowing up right now. So if you want to hear more about that topic, the national security topic, you can find the Freedom Report audio podcast, again, on iTunes or on Stitcher. That's the Freedom Report podcast, and you can download that every single day. You can also find it at thelibertarianrepublic.com. Tonight's topic will be whether or not an Obamacare repeal will actually happen. Now, we did see that President Trump signed an executive order demanding that the agencies of the executive office start to put together a plan to phase out Obamacare. Of course, we would need a full legal repeal since the law was actually passed and signed by the former president of the United States, Barack Obama. And so it will take a full repeal. And of course, it was upheld by the Supreme Court. So it will take a full repeal by Congress for that to happen, and it looks like there is some doubts about whether or not that will happen, according to some news that came out of Capitol Hill today. So we do have some good news, we have some bad news, and then we have some worse news. Let's talk about what's happening right now. The CEO of Aetna has stated today that Obamacare is apparently in a death spiral, so it may die a natural death before Congress even has a chance to repeal it. The chief executive officer, Mark Bertolini, has escalated his criticism of the ACA, saying that the markets for Obamacare are in near failure as premiums are climbing and healthier people are opting out. It's in a death spiral, Bertolini said in a video interview with the Wall Street Journal. He also predicted that more insurers will drop out of the market for 2018 following Humana's decision today to quit Obamacare entirely for the next year. Aetna, too, is mulling whether to further reduce its presence in the market set up by the ACA. The company cut its footprint to 4 states for this year, down from 15, after losing $450 million on sales of ACA plans last year. That kind of stuff, that cannot go on for long. Bertolini has been saying for months that ACA's markets are deteriorating. In last October, he said that rising rates would push healthy people away from Obamacare, leaving insurers with sicker customers and forcing premiums even higher. The increasing burdens of medical care costs as fewer and fewer healthy customers enroll are among the conditions that are creating this death spiral. Some healthcare experts have disputed the idea that Obamacare is experiencing a death spiral. So, for example, Matthew Fiedler, a fellow with at the Center for Health Policy at the Brookings Institution, a liberal institution, so you know they're going to say this, says that the small decline in Obamacare enrollment in 2017 compared to 2016 was probably not driven by climbing premiums. Most individuals get subsidies helping cushion the effects of rising costs. Quote, marketplace premium increases had little if any impact on marketplace signups, providing strong evidence against claims that these increases would send the individual market into a death spiral, he wrote in an analysis on February 8th on the Brookings website. Wow. The liberals are absolutely freaking out right now. This is Obama's legacy. What else did Obama do during his presidency other than to get people killed in Benghazi, to destroy our healthcare system, and to make our country safer, weaker, and less economically viable? So I think that the liberals are absolutely, besides themselves right now, and they're looking for any excuse. I mean, what kind of moron do you have to be to say that rising premiums are not what's driving people out? I mean, we don't have a growing economy. As a matter of fact, the economy shrank in the fourth quarter of last year. That's according to Steve Forbes. we understand as libertarians that when costs go up, people are going to have a flight to safety, or they're just not going to pay for something. That's basic economics. And this seems to me like it's the type of thing where liberals are just trying to do whatever they can to make any excuse for the miserable failure and for the disastrous economic policies that they have wrought in the United States. The next story is a little bit of good news, and this comes out of the Los Angeles Times. Don't call it fake news, guys. I'm so sick of that. Trump's IRS stages a stealth attack on Obamacare. This is written by Michael Hiltzik, coming out today from the LA Times. The IRS has become the first agency to follow President Trump's directive to start undermining the Affordable Care Act. In a quiet rule change, but an important one, the IRS told tax preparers and software firms that it won't automatically reject returns that fail to state whether the tax filer had health insurance during this year. This is good news. That effectively loosens enforcement of the ACA's individual mandate. It appears to be a direct response to Trump's January 20th executive order requiring federal agencies to, quote, minimize the economic and regulatory burdens of the act. We observed at the time that executive order would cripple ACA insurance exchanges, not only by signaling the Trump administration's open hostility to Obamacare, but by kicking out a leg from the regulatory stool that supports the act. The IRS action is the first manifestation of that. The agency hasn't announced its rule change publicly, but it was picked up by Peter Suderman of Reason and Kathleen Pender of the San Francisco Chronicle, who both reported it yesterday. In an emailed statement, the IRS said that it was acting in direct response to the executive order, which it said, quote, directed federal agencies to exercise authority and discretion available to them to reduce potential burden. Consistent with that, the IRS has decided to make changes that would continue to allow electronic and paper returns to be accepted for processing in instances where a taxpayer doesn't indicate their coverage status. Good news. The ACA requires individuals to carry health insurance or pay a penalty as much as $695 per adult and $347 per child under 18. This is line 61 of the IRS Form 1040, requires taxpayers either to check a box certifying that family members had coverage during the year or to enter their penalty, which is calculated on a separate form. Starting this year, the IRS was planning to reject returns, so this year this was when they're going to start really enforcing it, on anyone who had left line 61 blank, and this was known as, they were calling it silent returns. That would give taxpayers an early warning for electronic filers, an almost instant warning that they might be in violation of the instant mandate, of the individual mandate. But early in February, early this month, the agency told tax preparation firms that it was reversing the rule and would continue to accept returns that were blank. The agency didn't announce its policy to the general public, but word spread rapidly in the tax preparation community. Drake Software, which produces tax preparation software for accountants, posted a notice of the rule change on February 9th and updated its program to allow for e-filing of client returns without line 61. So that is really good news, and that means that people are most likely not going to be fined if they don't pay for their Obamacare mandate. And of course, libertarians and conservatives and limited government types should all be applauding this. I mean, even liberals, and I wouldn't say like not classical liberals as we understand it, but even leftists should be in favor of this, because it's one thing to argue that everybody needs insurance. It's another thing to force everyone to have insurance, because it's not even the sort of socialist style plan that they would want. I mean, a socialist communist style plan wouldn't be forcing everyone to have health insurance. They would just force everyone to have health care, meaning that what the socialists and the communists and people like democratic socialists, people like Bernie Sanders, what they want is single payer. Well, libertarians want single payer too, but the difference is that socialists and communists and democratic socialists, they want single payer being the government. Libertarians want single payer to be the individual, and we believe that this is because it would bring healthcare costs down, because people would shop around, people would buy insurance maybe just for catastrophic healthcare needs, but they wouldn't be going out and being forced to buy health insurance. And that's the kind of thing that just doesn't make anybody happy. It's not the right move, it's authoritarian, and it's an intervention into the marketplace that has, as we have seen, had the kind of negative unintended consequences that conservatives and libertarians always argue against. So the bad news, the really bad news, the horrible, awful, terrible news that everybody came here for. And you know me, I don't like to fearmonger, but I do like to raise red flags whenever I see something that's problematic. And when I see Rand Paul is upset about something or he walks out of a meeting like he did today, then we know we've got a problem. This is from Politico.com today, and the title is "Doubts Grow That GOP Can Repeal Obamacare." Probably only Donald Trump can whip the party's warring factions in line, but so far he's sent vague and conflicting messages. Listen to this. Republicans have reached a gut check moment. After spending more than 6 years vowing to fix the flagging patient that is Obamacare, it's the GOP's own repeal effort that's on life support. Undoing the health care law despised by conservatives seemed to be a straightforward proposition for the party after it won the White House and retained control of both chambers of Congress. Instead, Republicans are sniping over how much of the law to scrap, what to replace it with, and when. At this moment, it's far from a sure thing. Any plan could get through Congress. As my good friend Richard Bell recently said today, count on the Republicans to snatch defeat from the jaws of victory. Consider Paul Ryan's feel-good meeting with Senate Republicans on Tuesday. The House Speaker trekked across the Capitol to reassure senators and lawmakers are making more progress toward repealing the health care law than the media are reporting. But not everyone was buying it. Senator Rand Paul left before it was over, having heard enough of a conversation that he says centers around keeping Obama's Medicare expansion intact and creating tax credits that he called a, quote, new entitlement program. Though a Republican in the room rebutted the notion that the topic of Medicaid expansion came up in the Tuesday meeting with Ryan. Quote, "I hear things that are unacceptable to me," Paul said in an interview afterward. "If they don't seem to care what conservatives think about complete repeal of Obamacare, they're going to be shocked when they count the votes." Ryan's efforts precede Wednesday's visit by newly confirmed Health and Human Services Secretary Tom Price, who will attend the luncheon with Senate Republicans, ostensibly to articulate President Donald Trump's position. In addition, Republicans are pressing Price to do as much as he can through executive actions to buy them time to come to a consensus this spring. Well, thanks, Republicans. It may take a direct intervention from Trump to get the party's warring factions in line. Quote, "It's hard to see how this gets done unless the president says, okay, let's do it this way," said Senator Lamar Alexander of Tennessee, a key committeeman chairman on Obamacare. But it's been a while since Republicans have heard something substantive from Trump on Obamacare. When the president weighed in constructively last time, he was prompted by Paul's appearance on a cable news show, when Paul railed against efforts to repeal the law without a replacement. Trump called up Paul to offer his support. Interesting, right? At first, Trump's call to repeal and replace simultaneously disrupted the party, which at the time was intent on repealing now and figuring out the rest later. But eventually, they came around to Trump's apparent position and stopped sniping for a few weeks. Now that the party is back in disarray, no one is quite sure what Trump wants. They're straining to read the tea leaves from a president whose latest statements about Obamacare have confused the timeline and offered no clear direction. Ugh. Quote, "Right now, I would say it's not that easy to repeal it. I don't know if it's a guarantee," said Rep. Peter King. "I don't know where the White House is. The president has said he's not going to be kicking people off the program, off the rolls. He's not going to do that." Well, we all wonder if maybe the fact that the Trump administration is in total disarray over their national security problems and over the issues with Michael Flynn, this might be confusing the issue. This might be why Rand Paul said earlier today, and why I talked about my podcast earlier, why Rand is trying to refocus everyone on Obamacare, because he sees the chances of reform slipping away in the myriad of scandals that seem to be emerging in this very new Trump White House. It's very disconcerting. Speaking at the White House alongside Ryan, Trump said simply, quote, "We're working on Obamacare. It will be very soon." But they did nothing to clear this up of what's happening. The main dividing line is between centrist-minded lawmakers urging caution and deliberation. Lamar Alexander is a leader of that faction, and conservatives demanding action now. It appeared that the take-it-slow camp was winning out just last weekend. Republicans increasingly gravitated toward an approach that would stuff as many replacement provisions into a repeal bill as possible, taking advantage of a parliamentary tool that allows them to avoid a Democratic filibuster in the Senate. But that approach takes time, for one, to figure out whether the proposal complies with Senate rules, and the House Freedom Caucus, our buddies, grew antsy. Now, the Freedom Caucus, in tandem with Paul, who's been meeting with a rowdy band of conservatives regularly, are pushing for another vote on a 2015 repeal bill that was vetoed by President Obama. That was originally the starting point for Republicans after the election, but now some Republican senators are wary because there's no guarantee it would be replaced with something satisfactory to millions of their constituents. The divide has put Republican leaders in a jam. And you know, you've been seeing these town halls that have been going on. A lot of these Republicans have been running away because the constituents all across the country are crying out, many of them are crying out not to repeal Obamacare. A lot of these people are social democrats. A lot of these people are poor people who are counting on the provisions of Obamacare for them to have insurance. You can understand why they feel that way, even if we don't agree with them. As a matter of fact, I posted an article just last week. Only freshman Congress, or not, he's not a freshman anymore, but Congressman Justin Amash of Michigan in the House Freedom Caucus is the only one who's actually stood up to his constituents and had the guts to say that he doesn't agree with his constituents, that it needs to be repealed. So we've got to give some kudos and some shout outs to the main man, Justin Amash, for doing his job and for not being afraid. You know, if I were a congressman or if I was a senator, I would be the same way, because I would not be afraid of confrontation or to tell my constituents what I think is the right thing to do. Now, that isn't the kind of thing that helps you get elected, though, but perhaps there are some good, some vestiges of freedom left in the show me state. Quote, "It's hard," said Senator John McCain. "Oh, if it were just up to me, I'd have the plan tomorrow." Ryan tried to offer a soothing message to Senate Republicans on Tuesday. He laid out a timeline that would have the House GOP start the repeal process by the end of February and pass a bill by the end of March, attendees said. Vice President Mike Pence also attended the meeting but said nothing about Obamacare. But Ryan's reassurances only served to paper over real differences of opinion among Republicans. The party has very little room to maneuver, with a narrow 52 to 48 majority in the Senate and a block of Freedom Caucus members in the House that could, in theory, block the GOP's repeal efforts. Still, senior House Republicans believe that they have the upper hand, if for no other reason than it will be extremely difficult for any GOP member to oppose Obamacare repeal legislation, even if it's not entirely to their liking. Quote, "It's very hard to vote against repeal of Obamacare in any form, no matter who you are or where you are on the Republican spectrum," said Tom Cole of Oklahoma. If Republicans take the Paul Freedom Caucus approach, there's little chance that senators from states that have expanded Medicare under Obamacare would go for it. Yeah. The conservatives' plan would allow for a 2-year transition time away from Medicaid, but 20 GOP senators are from expansion states, and they want more time now and more stability for hundreds of thousands of constituents that rely on Medicaid now for insurance. It's a mess, ladies and gentlemen. Quote, "There are certain aspects of a repeal mechanism that are extremely important to me, and that Medicaid expansion piece is one," said Senator Shelley Moore Capito of West Virginia. Although Trump could conceivably whip the competing GOP factions into line, some GOP officials privately say they've been tuning him out. The president's shifting public statements sometimes don't match with what aides are saying behind the scenes. Trump has called Ryan to discuss health care on a number of occasions, and Jared Kushner, his son-in-law and senior advisor, has expressed interest in the subject, said several people familiar with the matter. At one recent meeting, Trump referred questions about Obamacare to Ryan for the details, according to a person who was present. At a recent congressional retreat, Andrew Bramberg, a senior policy advisor in the White House, gave remarks to aides and members, but several people who attended the briefing said it was clear the White House did not have most of the specifics figured out. GOP leaders may be able to arrive at a bill without Trump, but selling it to congressional Republicans and the public requires a microphone that only Trump has. Congress is about to head home to more town halls filled with constituents who are worried about their health care. Quote, statements from the White House about it, frankly, would be helpful, said Rep. Carlos Curbelo, a moderate Florida Republican. Republicans said Price's word is as good as Trump's on Obamacare, giving him an important assignment on Wednesday. But when Price addresses the Senate Republicans on Wednesday, Paul, for one, won't be there. He's scheduled to give a news conference at that time with Freedom Caucus members about his bare-bones Obamacare replacement. Ladies and gentlemen, they need to get on board Rand Paul's plan, and they need to get on it quick. And, you know, as hardcore libertarians, it's not like Rand Paul's plan is perfect. We've talked about it before. It's not a perfect plan, but I think it's probably the best they can go with right now. And that means that Donald Trump and Rand Paul have got to get together. And whatever's going on with the national security problems that are happening in the Trump administration, they need to get a lid on it. They need to get that under control, because that threatens to send that administration into a death spiral right now. And all of the hubbub that's going on, I can see, is probably what's ticking Rand Paul off. Excuse me. Live show. What can you do? But you know, a lot of people were angry at Rand Paul for not launching an investigation and what's going on with Michael Flynn. Well, if anything, if I had to guess, it's probably because of this. It's probably because right now the Republicans are in disarray, trying to come up with a plan that they can all agree on. I think everybody needs to get together on Rand Paul. If the Liberty Movement has any sway or has any mechanisms by which they can actually take action, now is probably a good time to get behind Senator Rand Paul and his plan to repeal Obamacare. And that you can find that actually at thelibertarianrepublic.com. We've reported on it multiple times. If you go to thelibertarianrepublic.com after this show is over, just type in Rand Paul Obamacare. You should be able to find the article. It should pop up there pretty quickly, or you can just type in the Libertarian Republic Rand Paul Obamacare on Google and it should pop up as well. But if you guys want, if we want to get ourselves some real change, some legislative change right now, we can't be worrying too much about what's going on with the national security issue. It is an important issue, but the fact that the Republicans are waffling and waving and freaking out right now, if you've got a congressman that is one of those moderate Republicans and if you're in a Medicaid expansionist state, it is incumbent on you to contact your representative and express their support for Senator Rand Paul's bill. So I'm going to do everything that I can to support Rand Paul. I'm going to be at CPAC next week. I'm going to do everything I can to try and talk it up. I'll be there with the Stonegate Institute. If you're going to be there in Washington, D.C., come out, shake my hand, take a picture. Let's get to know one another, and let's work together more and fight for liberty. If you like what you're watching right now, ladies and gentlemen, I'm very grateful. The only reason that I'm able to continue to do this and support myself is because of viewers like you. So if you want to continue to support us, you can do it for free simply by sharing this live stream on Twitter, on Facebook, anywhere that you like. Share this YouTube stream, or if you're on Facebook, do me a favor, share it on your timeline as well. If you want to contribute financially and you want to get something back for it, you can get your Make Taxation Theft Again hat at threadsofliberty.com. Get this cool hat. It's at threadsofliberty.com. It's called the AP Collection. We've got some other cool new products coming out as well. We also hired a new employee today. Very excited to hear that James Chillemi has come on board the Stonegate LLC. Just so you know, I've got my private corporation, which is Stonegate Pictures LLC. I've also got Disruptive Dynamics LLC. Those are my for-profit ventures. And I've got nonprofit ventures. That's the Stonegate Institute, Stonegate PAC, and Loki PAC, and those are the nonprofits that are working. It's all my myriad of institutions and for-profits and nonprofits. It's my burgeoning empire of liberty. But you're the reason that it exists. You, actually the viewer, the people who are watching right now, the commenters, people like Brad Howard, Kenneth Casey, the Libertarian Defense Atheist, Robert Griffiths. It's because of people like you and your support that I'm able to do this, that I'm able to fight for liberty. Those institutions, they're small, but they're growing, and it's because of people like you. So if you want to contribute directly to my nonprofit institutions, you can go to the Stonegate Institute, and that's stonegateinstitute.org. That's how it's spelled right up there, G-A-I-T. And if you want to help my for-profit ventures and make Augie P a little bit of money, you can go to threadsofliberty.com, get a cool hat, or you can go right here to libertyviral.com and share articles from that site, or my flagship site, thelibertarianrepublic.com. We're growing, and it's because of viewers like you. I cannot thank you enough. Have a fantastic night, and stay free.